Good morning to all. My team is Godavari River, Meenakshi Hospital, the laboratory service in Tanjavur. My team members are Vivekanandan, Quality Manager, Arun Pandian, Section In Charge, myself Divya, Microbiology Technician. Today we are talking about early diagnosis of bioprognostic markers in SARS-CoV-19 for quickly recovery from SARS-CoV-19 complications. Inflammatory and prognostic markers in SARS-CoV-19. Test names are interleukin-6, Department Biochemistry, purpose cytokinin storm, CRP microbiology, purpose inflammations, D-dimer hematology, blood clot, ferritin biochemistry, hyponemia, lack of oxygen inflammation, HS tropii biochemistry heart attack, procalcitonin biochemistry blood infection, SARS-CoV-19. Today we are challenging pandemic disease SARS-CoV-19 named by WHO. SARS-CoV-19 spread by novel coronavirus is associated with high morbidity and mortality. SARS-CoV-19 is developed mild symptoms such as dry cough, sore throat, fatigue and fever. Majority patients recovered from SARS-CoV-19 with good clinical care and treatment. Some patients developed fatal clinical complications such as heart attack, organ failure, sepsis, acute respiratory distress syndrome and finally died. SARS-CoV-19 in biomarkers. SARS-CoV-19 can stimulate serious hyperinflammatory response and cytokinin storm. Biomarkers of SARS-CoV-19 helpful for track and indicate systemic inflammations of patient SARS-CoV-19. Inflammatory biomarkers. Interleukin C reactive protein. Interleukin-6. Interleukin is one of the main mediator of inflammatory and immune response initiated by infection or injury. Increased levels of IL-6 are found in more than one of patients with COVID-19. C reactive protein. C reactive protein is one kind of biomarker in SARS-CoV-19 because it elevated in inflammation of the patients. We observed 86% of severe COVID-19 cases CRP level increased, coagulation parameters in reliable prognostic markers. It's helpful for patients need critical care support on admissions conditions. The patients with over 60 years have ferritin and D-dimer were abnormal with 65% higher than normal range. Prognostic markers are D-dimer, ferritin, HS tropii, procalcitonin. D-dimer. D-dimer test can be used to help rule out presence of serious blood clot. It's good prognostic marker for SARS-CoV-19 patients due to coronavirus induced blood clot formations. Ferritin. COVID-19 pandemic ferritin level have significant prognostic marker. Increased ferritin level could be indicate for a strong inflammatory reactions and impact on iron metabolism. Elevated ferritin serum levels have been found significantly correlate with disease severity in COVID-19 infected patients. HS tropii. Cardiac HS tropii as cardiac biomarker and important prognostic marker for patients hospitalized COVID-19. Coronavirus has in COVID-19 may advisedly affect the cardiovascular system. High HS tropii level are associated with increased mortality in patients with SARS-CoV-19. Procalcitonin is a biomarker of bacterial infection and a prognostic tool of COVID-19. Pandemic shown higher level of PCT in severe COVID-19 cases reflect on set a critical pace of viral infection.
Brief history of case study. Description of the problem. To identify the problem in COVID, delayed reports and delayed patient care. Analysis of problems. Delayed reporting of the above mentioned markers caused delay in initiating the treatment. Root cause of the problems. Delayed reporting as there are outsourced mode of test process and increased workload. Solution implemented. Inflammatory markers and prognostic markers were started here. Markers process promote to higher throughput machine in our laboratory within TAT. Gains. Reduce the TAT. Doctors and patients satisfied. Timely care to patient. Mortality and morbidity rate decreased. Statistical tools used. Data collection, milestone chart, PDCA cycle, fishbone, flow chart, bar chart. Methods. Category analysis, ranking method, patient needs. Category of selection, pandemic, doctor's feedback and suggestion. Problems will be solved in our lab itself due to life saving from infection and inflammation with reliable reports. International article read. We selected problem for life saving from pandemic as our first choice. Ranking method to priorities problems, pandemic, 20% number of hours. Reduced turnaround time, number of hours 19. Outsourced 9 number of hours. The emergency department, cardiology department, pulmonology department, medicine departments are we have selected pandemic reduced turnaround time on priority basis. KAIZEN activity planning milestone chart. Project reducing turnaround time and reducing of cost. Reason for selection. Procedure. Define the problem, analyze the problem, identifying causes, root causes analysis, data analysis, development of solutions, implementation, verification. All are finished in within 8 days. Effects due to outside lab versus our lab. Test in outside lab, sample transport delay, report transport delay, treatment delay, cost of test high, doctors highly unsatisfied, patient will go for unnecessary complication. Test in our lab, sample transport within 15 minutes, report informed to doctor within 1 hour, immediate treatment, cost of test low, doctors highly satisfied, patient good prognosis. Problem analysis, cause and effect diagram, YY analysis. Fishbone analysis. Personal lack of training, lack of awareness, outsourced lab test, transport delay, report delay. Test method, manual work, prolonged process time, equipment semi-auto analyzer, prolonged analysis. YY analysis, primary cause increasing TAT, test not done in side lab, sample sent outside lab, sample process in outsource. Increasing cost, test not done in our lab, test source not available, test done in outside lab. Frozen KAIZEN data analysis 2022-2021 for outside lab. Interleukin 6, cost 4,000, turnaround time 3 days. Ferritin 1,500, 3 days turnaround time. Procalcitonin 6,300, 3 days. HS troponin 2,000, 1 day. D-dimer 1,850, 1 day. Development solutions. Doctors give awareness about the importance of COVID screening markers. We plan to do these COVID screening markers in-house, make a list of requirements, train all staffs to handle the instrument and purpose of COVID screening markers, test upgradation in fully auto analyzer, test verification. Solution and implementation. Plan, do, check, act. Plan to reduce the test turnaround time and cost, make a need of requirements and start the test in-house. Reporting time is reduced and cost reduced. Test done in our lab, report given quickly. Problem solving flowchart, sample receiving, test done in our lab, sample processing in our lab, report ready within an hour, inform the doctor, earlier detection of inflammation. Doctor take immediate action, immediate treatment, patient speedy recovery by earlier treatment, patient saves from COVID complication. Inflammation and prognostic markers SOP. CRP, equipment name AU480, turbidometry, sample volume 5 ml, reporting time 1 hour. Test name D-dimer, machine IL, method nephrometry, 5 ml sample volume, reporting time 1 hour. Ferritin, machine name access to, method CLIA, sample volume 5 ml, reporting time 2 hours. HS troponin access to, method CLIA, sample volume 5 ml, reporting time 45 minutes. IL6, machine name access, method CLIA, sample volume 5 ml, reporting time 2 hours. Procalcitonin, machine name AU480, method turbidometry, sample volume 5 ml, reporting time 1 hour. Test updation for fully auto analyzer. Test verification. Training given to all staffs. After KAIZEN.
After KAIZEN in-house lab, the lab test, cost of outside lab, cost of in-house lab. Test name CRP, outside lab 1,000 rupees, in lab 550. D-dimer 1850 880. Ferritin 1,500 1,160. HS troponin 2,000, our lab 1,000. IL6 4,000, our lab 2,500. Procalcitonin outside lab 6,300, our lab 3,000. Cost comparison chart.
In-house lab.
Turnaround time chart. Test report time comparison chart. Physician feedback. Standardization. Repeated staff training on biomarkers and prognostic markers. Staff monitoring about follow-up of SOP by section in charge. Continuous test verification. Collection of patient and doctor's feedback. Discuss and take action on monthly meeting. Follow-up chart. Sample receiving, sample processing and laboratory services. Report ready within 1 hour. Information to doctor. Doctor take immediate action. Give treatment to patient. Patient speedy recovery by earlier treatment. Tangible benefits. Turnout time 2 hours. Start time 1 hour. Report informant within 10 minutes. Patient's recovery from SARS-CoV-19 complication. Patient test report cost 50% save. Intangible benefits. Improve the patient care and treatment. Save the patient life. To save cost for patient. Patient doctor satisfied. Mortality and morbidity decrease. Thank you.